On April 12, 2016, Karen Johnson and her husband Charles Johnson went into Cedars-Sinai Medical Center to deliver their second son via C-section. What was supposed to be a joyous day turned into a tragedy within hours. 10 hours later, after continuously trying to get his wife medical attention for the blood he saw in her catheter, sadly, Kira passed away. When doctors finally decided to take Kira to the procedure room, her husband waited. After 15 minutes, two nurses came out and told him his wife had heavy internal bleeding and had flatlined. He was also informed that they had found 3.5 liters of blood in Kira's abdomen, meaning for 10 hours she was bleeding internally, and doctors ignored her husband's plea that she needed medical attention. During a 2019 ABC News interview, Charles Johnson stated that his wife was perfectly healthy when they went into the hospital to deliver their son. So, how does a seemingly healthy woman die merely hours after receiving a C-section from a non-profit hospital that is currently ranked as the 8th best hospital in the country by U.S. News and World Report? Well, let me tell you why. In today's speech, I am going to explain the reasons why the maternal mortality rate is higher in African American women because of the deeply ingrained biases and prejudices and systematic racism that have been embedded in our healthcare system for centuries, and give solutions on how we can solve this problem. Maternal mortality rates in the United States are high and a critical issue that demands attention. This imbalance is a direct result of the deeply ingrained biases, with prejudices, and systematic racism that have been embedded in our healthcare system. To help lower these rates, we can improve access to quality prenatal care, address explicit biases in healthcare, and promote policy changes to address social determinants of health. According to the Center of Disease Control and Prevention, CDC, African American women are 3 to 4 times more likely to die from pregnancy-related causes than a white woman. This imbalance is shocking and unacceptable, especially in a country that prides itself on giving its citizens quality health care. In a study conducted by the CDC, it was found that African American women have a maternal mortality rate of 37.1 deaths per 100,000 live births, compared to the 14.7 deaths per 100,000 live births for white women. The fact that African American women are 3 to 4 times more likely to die from pregnancy-related causes than a white woman is a national disgrace. We cannot continue to ignore this issue and must take immediate action to address the systematic inequalities that perpetuate this imbalance. Dr. Michelle Williams, Dean of Harvard T.H. Chan School of Public Health, stated, Dr. Michelle Williams' statement highlights a crucial issue in healthcare that needs urgent attention. Addressing the systematic inequalities in healthcare is crucial to ensure that all individuals receive equitable and quality care regardless of their race or ethnicity. Policymakers, healthcare providers, and communities need to work together to implement solutions that can help reduce this imbalance and improve maternal health outcomes for all women. Kira Johnson's story serves as a heartbreaking reminder of the urgent need to address the racial imbalance in maternity health care. However, she's just one of many women who have suffered. Tennis star Serena Williams have been vocal about her own experience with childbirth and the complications she faced. In an article for CNN, she shared her story of giving birth to her daughter Olympia and the life-threatening complications she encountered. Williams suffered from a pulmonary embolism shortly after giving birth, a condition that occurs when blood clots travel to the lungs and blocks blood flow. She emphasizes the importance of advocating for oneself in the healthcare system, stating, if it wasn't for my own aggressive instincts and my husband's strength, I wouldn't be here today. Williams has used her platform to raise awareness about the imbalance in maternal health care, particularly for African American women. In an interview with Vogue, she discussed the higher rates in maternal mortality among Black women in the United States, stating it is hard to escape the statistics that Black women are 3 to 4 times more likely to die from pregnancy or childbirth-related causes. The solution to this crisis is clear. We as a society must advocate for and support Black women when we witness unfair treatment and discrimination in healthcare settings. We must stand in solidarity with African American women, amplify their voices, and demand justice and equality in healthcare. I've listed 3 solutions that can help with this cause. The first solution is that we can improve access to quality prenatal care. African American women face barriers to accessing quality prenatal care, which can lead to adverse maternal health outcomes. Advocating for policies that improve access to prenatal care, such as Medicaid expansion and community-based prenatal care programs, can help address this issue. Next, we can also address implicit biases in healthcare. Implicit bias among healthcare providers can contribute to an imbalance in maternal health outcomes for African American women. Advocating for cultural proficiency training and anti-bias education for healthcare providers can help reduce imbalance in care. Lastly, we can promote policy changes to address social determinants of health, such as poverty, racism, and lack of access to education, which contribute to the imbalance in maternal healthcare outcomes. Advocating for these policies that address social determinants such as increasing minimum wage, expanding affordable housing, and promoting educational opportunities can help improve maternal outcomes for African American women. You can do all these solutions by starting support groups or voting for policy changes. It is clear that the imbalance in maternal health rates among African American women are a pressing issue that demands immediate attention. We cannot afford to turn a blind eye to the systematic inequalities contributing to this alarming statistics. The reason for this high mortality rate is because of the biases, prejudice, and the systematic racism. All of us must advocate for the policies and practices to address these imbalances. We can do that by improving access to quality prenatal care, addressing implicit biases in healthcare, and promoting policy changes to social determinants of health. Together, we can work towards creating a healthcare system that is unbiased, just, and inclusive to all women, regardless of their race or ethnicity. If we work together, we can prevent tragic stories like Kara Johnson's from happening to African American women all over the world.